Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Graban, welcome to podcast number 150 for June 6, 2012. My guest today is Dr. Jeffrey Lebosky. He is author of the book, It's Enough to Make You Sick, The Failure of American Healthcare and a Prescription for the Cure. So in this episode, he'll be talking about what he thinks is lacking in current healthcare reform efforts that are driven out of Washington. And we'll also talk about how he defines the crisis in healthcare. Why are things going bad, as he puts it? Then after we try to diagnose the problem, he'll talk about some ideas, some treatments, cures, or solutions that we can all work on together in the health system. For this episode, you can go to leanblog.org/150 to see links to the book and more. And you can go to leanpodcast.org for all past episodes. As always, thanks for listening. Well, Jeff, I appreciate you taking time out of what I'm sure is a very busy schedule to talk to us today and talk about your book. Thanks for being here.
Oh, well, thank you for having me. I look forward to it.
So, before getting into the book, curious to hear about your professional background and if you can introduce yourself to the listeners.
Sure. I'm a neurosurgeon. I primarily deal with brain and spinal cord issues. And I'm also an associate clinical professor in the Department of Neurosurgery at the University of California, San Francisco, as well as having a private practice up in Chico, where I am a co-director of our neurotrauma intensive care unit. I've been in practice for about 28 years, and I've pretty much balanced both a clinical practice and an academic interest as well.
And so with all that going on, taking time to write a book, and again, the title is It's Enough to Make You Sick. What got you so fired up to go and write the book? Can you even tell us how that came to be and give us an overview of what you've written?
Well, it's interesting. We were about 4 or 5 years ago in our own community here. We went through somewhat of a crisis that entailed the medical staff and the hospital administration, and it really took its effect on the community, and it took its effect on me personally. And I found that the rancor and the animus that was associated with this really kind of took the wind out of my sails. I mean, I'd been practicing at that time for 23 years. And I used to look forward to getting up every day and going to the hospital and doing surgery and seeing patients. And all that we went through really kind of blunted that. And I found that I wasn't liking my job anymore. And I found that I was doing the same thing that many of my colleagues do, and that's sit down in the doctor's lounge and complain, just complaining about the state of medicine, complaining about the insurance companies, complaining about the hospital, complaining about everybody. And my wife had the insight to say, look, Jeff, you aren't the doc you used to be. You need to get that back. You need to kind of get your spirit back. And so she was the one who actually suggested I write this book. I've always enjoyed writing. I'm the editor of my high school newspaper, and I've always enjoyed that part of my life. But I thought, okay, fine, I'll sit down and maybe do some research to write a book without really feeling that I'd ever finish it. And then when I'm in the process of beginning that, the presidential election, the last presidential election comes into play, and all of a sudden healthcare gets pumped to the forefront. And so what I did, my book was initially kind of a catharsis. And it was a way for me to kind of determine why things were going bad in medicine. Why we didn't have that same relationship with our patients that we did a generation ago. And then it dawned on me that if I did nothing more than tell you why everything was wrong, I wasn't doing a service to my community. And it was important for me to try to understand what we could do to make this right. And so that I expanded the book to not only include kind of the history of how we evolved in healthcare and how we devolved, but more importantly, how we can really change it. And that it was fortuitous that this national debate on healthcare came up, and the whole issue regarding the Patient Protection and Affordable Care Act gave me an opportunity to view that and give opinions as to what would work and what wouldn't work.
Right. No, and it's funny you mentioned the high school newspaper. It's one thing you and I have in common. I went down an engineering career path, but I was also the editor of my high school paper and always enjoyed writing. as well. So I'm glad you're able to kind of revisit that. But before talking about the book, can you tell us a little bit more? You mentioned that there was that crisis. Was there an event, or is it just that healthcare had sort of just evolved to the point where it suddenly felt like a crisis that you were referring to?
Well, our crisis was that a group of physicians were going to leave the hospital, and they were leaving the hospital because the hospital could not afford to pay them enough to remain on staff. And, on the surface, that seems like a kind of a greedy thing to do. But when you looked at it and you saw the reasons behind that, and the whole reason that we started changing the way that physicians were reimbursed and the kind of relationship between hospitals and physicians, it finally dawned on me that this wasn't anything unique to our community. It was just our turn to go through this. Hospitals and communities across the country were repeating this time and again. And where I was practicing, this was just kind of our time to do this, and we did. And we were eventually able to do it successfully and resolve this, but not without a lot of angst and gnashing of teeth.
Okay, yeah. And so, I'm sure a lot of what you then end up thinking about and writing about in terms of that question of why things are going bad, I'm sure some of that ties into the crisis. So, let's talk first about, defining the problem, and then ideas about what to do about the system. When you say you're investigating why things are going bad, what are some of the key things that you think have led to kind of the current state of where we are, where there's a lot of cases where physicians, surgeons, medical staff are unhappy, patients are unhappy for different reasons. What have you found, and what did you share in the book?
Well, I think that's a good point. It's everybody's unhappy. There's very few people that are happy with our state of affairs. And yet, we hear our politicians on both sides of the aisle even stand up and say, this is America. We've got the greatest healthcare system in the world. Well, we don't. And until we face that fact, we're not going to solve this. And, we have a healthcare system that's spending about $2.6 trillion a year and almost 18% of our gross domestic product on healthcare. And yet, we have 45 million people who have no insurance. We have another equal number of people who have insurance, but it's so inadequate it does not give them access to care. We do no better than mediocre when we compare our system with the other systems around the world, and we do it at twice the cost. And until we come to grips with that, I think that's an indictment of the entire system. Now, who's to blame? Well, I think it's easy. It's easy for us to blame the usual suspects, as I call them. We blame the insurance companies. We have insurance companies who for years have essentially denied coverage to people who needed it. People with pre-existing conditions could not get insurance. Well, that's absolutely ludicrous. It is absolutely ludicrous in a country as wealthy as ours that we have a fair number of people who say, well, you have high blood pressure or you have diabetes, so you don't get care. That makes no sense. We have an insurance company insurance companies that now have to answer to their investors on Wall Street rather than to their patients. And profit becomes the driving force. And so it's easy to blame insurance companies. We all do that. But then we blame the pharmaceutical companies. The pharmaceutical companies sit there and make drug after drug, which oftentimes is no better than what's available on the market. But they then go on and market that to us as consumers. And we're spending now billions of dollars on medications, but it isn't making us any healthier. We blame our lawyers, especially physicians. We love to blame the attorneys and say the whole problem is malpractice. We've got greedy attorneys. Well, we do. But this system of malpractice doesn't protect doctors from frivolous lawsuits, but it also doesn't protect our patients from negligent care. The studies clearly show that the majority of people who suffer an injury as a result of medical negligence never even file a lawsuit. And that the majority of the time that physicians are sued for malpractice, they have no culpability. So it's a lottery mentality. And those are usually the three big people that everybody likes to blame. But I think that in order for us to solve this, we have to take a collective culpability. And so I, in my book, talk about the role of our politicians, the politicians who essentially take all this special interest money and do the bidding of the lobbyists rather than the bidding of the public. They like to pass laws that sound really good and make great sound bites on C-SPAN, But, if they ever talk to any of us working in the trenches, we would tell them this isn't going to work. But they don't do that. They don't do that. And then the other three that I think are oftentimes neglected are, first, our hospitals. Same thing. Hospitals were all usually designed by communities for communities. It was an asset to take care of the people within a given community. Well, as healthcare has evolved and we've gone to this, quote, market-based healthcare system, hospitals are now oftentimes part of a large chain of hospitals. Again, responsible not to their patients or their communities, but instead responsible to that community of investors on Wall Street who look at the bottom line of profit and loss. And they've changed their focus. But I also have to indict myself and the rest of the medical profession because, we've kind of been responsible for this as well. We've done very little to control the runaway costs of healthcare. We always kind of say, well, it's really not our problem. And so we've let the control of healthcare be wrested from our hands and placed into the hands of corporate executives. And I think we share a collective responsibility. And so physicians now find that they're spending less and less time with patients because they have to move them along, as I describe in the book, on an assembly line, because volume is the key here. You have to see more patients, you have to do more procedures. And so I think that we share equal indictment. But finally, the one group that I think always gets neglected is the American public. We look at the public as victims in healthcare. We say, geez, these poor patients. But we have a public that, as you can see from the recent news, that, a third of us are obese. 2/3 of us are overweight. Our kids are following at greater levels than that. And we still smoke. We drink too much. At any given time in this country, a quarter of all beds in an acute hospital are taken up by patients whose admission was the direct result of some type of alcohol abuse. I heard an interesting statistic just a few weeks ago that a third of all the burn units across the United States, a third of the beds are filled by patients who suffered their burns as a result of cooking methamphetamine. And over 80% of them are uninsured, and the cost to take care of them is excess of $6,000 to $7,000 a day. So the American public really needs to take its share of responsibility for this. We as the public, what we do is we plop ourselves down on a couch, and if we're liberals, we watch MSNBC, and if we're conservatives, we watch Fox News. And whatever those people tell us, we just kind of digest it and then regurgitate that as truth. And it's really time for us as individuals to look into these issues in a little bit more depth than that.
Yeah.
And so there's plenty of suspects to go around.
Sure. And, a lot of the political discussion, I think from both sides of the aisle, you hear a lot of talk about identifying and diagnosing the problem. And like I said, you can look at different players in the system. You can look at the system as a whole. It's easier to define that problem than it is to come up with real compelling solutions. So I'm curious, what do you propose in your book? What lines up or is different from that mouthful of legislation, the Affordable Patient Protection and Affordable Care Act. No wonder it gets an easier to say nickname. quote unquote Obamacare is easier to say. We don't call it Congress Care, but So what do you see as some of the key needed elements of reform? And again, maybe compare that to what had been passed into law.
Well, I think going back to just your earlier statement of calling it Obamacare is somewhat of a misnomer, because I think if you look back when Barack Obama was running for office 4 years ago, I think he clearly delineated for all of us what his vision was for healthcare. I mean, and we listened. We sat as a country, we listened to all the candidates, and I thought they were very clear on how they thought healthcare should be structured. And we listened and we voted for Barack Obama as a country. We elected him. And then when he tried to actually implement the plan that he had told us he was going to do, we let the special interests stand up and tell us how it was socialized medicine and wasn't going to work. And we just, again, bought into that. And we let that whole debate be co-opted by the extremes, I think, on the far right and the far left, instead of having that debate, reasoned debate in the middle where it needed to be held. In terms of how do you reform care, on the surface, I think it seems like a very daunting task. I mean, we've got this huge system. It's very expensive, and it's really, really important to the lives of everyday Americans. But I think it can be broken down into three basic things. One is universal coverage, and that means nothing more than making sure everybody has insurance. But equally important, which I think is oftentimes lost in this bill, is universal access. Because if you have an insurance card, that's really nice, and the Affordable Care Act essentially is going to give most Americans an insurance card, and we say, great, you have insurance. Well, it's not that easy. Try to go see a doctor if you have Medicaid. You've got a card. As the comparison I have in the book is, we gave you a jersey, we gave you a hat, we put you on a team, but you're never going to get a chance to play because nobody will see you. The chances of being seen if you're on Medicaid, because the reimbursement rate is so low, docs aren't going to see you, and that same access to care becomes a huge problem. And so that has to be addressed. And in the book, I talk about several ways. We don't have the time to go into detail here, but several ways that we can actually achieve that universal access and universal coverage, which are two of the three keys, which brings us to the third, and that is controlling costs. Because if you get everybody in this country good access to good medical care, it's not going to be cheap. And we have to control those costs. And there is a wide variety of ways that we can do that. But I think one of the ways that this bill fell short was they essentially cut out many of the ways to save costs, to save money. And for example, one of the issues that Barack Obama really pushed as a candidate was to get a government option for insurance for people who didn't have access to care. Well, it was interesting because the insurance industry just reared up its ugly head and made sure we told everybody that this was the government takeover of health care. I find it ironic that they have no problem with a government option or a public option for the elderly with the Medicare program. That's the group that uses health care more than anybody and has a very limited income. So that was okay. You could put those people in the government option.
Yeah, well, and Medicare is even more of a single payer kind of system, more so than being an option, right? If you're
correct.
Yeah.
Correct. And then the other end of the spectrum were the poor people who couldn't afford their premiums. That was okay to put them in a government option, put them in Medicaid. But what the insurance industry really didn't want was to have somebody compete with them, a government option to compete with them for those people in the middle, the people who were relatively young, relatively healthy, relatively low utilizers of healthcare resources, and paid their premiums or had them paid for by their employers, because that's where all the profit in medicine is made. And that's the one group that they had a problem with the public option for. And then you talk about, we can save money in pharmaceuticals. I mean, another thing, Obama told us he was going to make sure that Medicare had the same rights as every other insurance company to negotiate the cost of drugs for their clients. Well, the pharmaceutical industry came in with their money and their influence, and the next thing you know, that was taken out of the bill. And now the cost savings there has been estimated to be somewhere between $60 and $100 billion a year, which over the next decade would have been close to $1 trillion in savings. And then I think the most difficult part that we as a country are going to have to come to grips with, and it's going to be absolutely essential if we're going to make this work, is the reasonable rationing of healthcare. And nobody wants to use that word.
That's a dirty word.
It's a dirty word, and you have any politician who says that is going to get hammered. But we do that every day. We ration, but we don't ration based on whether a treatment is effective. We ration based on socioeconomic standards. If you have the money, if you have good insurance, you can have a mammogram every year whether you need it or not. But if you're poor, good luck. And that's rationing. That's rationing. Well, I'm saying we should ration, but we should ration based on evidence. Evidence-based medicine needs to be the cornerstone of our new healthcare system. And we say, look, if this procedure or this medicine or this treatment works to improve the quality of somebody's life, and this isn't talking about whether they're 100 years old or 2 months old. You don't ration based on age. It's rationing based on whether these treatments provide good outcomes, good quality of life outcomes for patients. And if we show that a treatment is effective in doing that with true evidence-based medicine, we should reimburse for it, and we should reimburse well for it. But by the same token, if we know that something is unnecessary or something is of marginal benefit, we shouldn't pay for it. Now, if you want to pay for it, that's fine. In other words, if you're 96 years old and we have evidence that tells us if you're 96 and you have a heart attack and you come in with an ejection fraction of 15%, we know the chance that you're going to get off the table for a cardiac bypass is less than 3%. We can't pay for that. We can't pay for that if we can't pay for kids' immunizations across this country. Does that mean that you can't have that operation? No, you're welcome to it, but you have to pay for it. You have to pay for it in my system.
Well, there's, I'm sure, a lot more detail, a lot more to chew on in your book. It's out now. It's called "It's Enough to Make You Sick: The Failure of American Healthcare and a Prescription for a Cure." Jeffrey Lebosky, thanks for taking time to chat today. Are there any final thoughts that you would want to leave the listeners with, either about something else in your book or something that they can do to take action to help make meaningful healthcare reform happen?
Well, I think that this is a huge issue. I mean, this is a huge issue not only as it relates to our health as a nation, but as it relates to our economy. If we let healthcare continue spiraling out of control, it's going to consume so much of our gross domestic product that every other social program, our national defense program, our infrastructure is going to suffer. So I think Americans really need to go back and take command of this debate. We can't let this be co-opted by the politicians who are simply looking for votes. It's too important of an issue because it's going to define who we are as a country, not only to ourselves but to the world around us for generations. And it's too important for us to let it be cannibalized by the extremes. So pay attention, stay involved, don't let this get off the front burner.
Okay, well, again, thank you, Jeff. Thanks for being our guest here today on the podcast.
Thank you for having me. I've really enjoyed it.
Well, thank you.
Bye now.
Thanks for listening. This has been the Lean Blog Podcast. For lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.